All right. So as Dr. Dixon has introduced me, I am Dr. Cheryl Loken from the state of Wisconsin within the United States of America. It is 7:30 in the morning here and a cold wintry day with snow. And today I will be going over feline anorexia and feeding tube placement. And as Dr. Dixon had mentioned, at the end of the presentation, I will be taking questions, and it does work best if you can put your questions in the chat box. And these slides will be available to you through the VetNet website, so you can refer back to any particular slides. All right, so we will be going over some of the causes of anorexia, the effects of prolonged anorexia, and why it's advantageous to promote early enteral nutrition and specific strategies to promote eating. Then we will look at the procedures to place both a nasoesophageal tube and an esophagostomy tube, what to feed and how much to feed through the tubes, and when and how to remove the tubes when you're done. So some of the causes of anorexia. An owner may bring a cat into the clinic for anorexia without really knowing if the cat is eating or not. So it may be perceived anorexia. If there's a multi-cat household and cats are fed free choice, or if the cats go outside and catch prey, an owner may not really be aware of what or how much a cat is eating. An easy way, obviously, to know for sure is to have the owner isolate the cat in question and feed it a specified amount of food in its own room. If it is eating and how much, you'll know at that time. There can also be refusal of the cat to eat because of a change in the type of food fed or the quality of the food. So asking the owner of any changes in diet, how the food is stored, and how old the current bag of cat food is are all important questions. If there's any change in the feeding environment, that can also lead to anorexia if it is by a noisy appliance, or if there's competition with other cats. And then obviously illness, whether acute or chronic, can cause anorexia, as well as pain or an obstruction. Some of the effects of anorexia on cats include intestinal muscle atrophy, increased infectious complication due to bacterial translocation from the gut, delayed wound healing as there would not be adequate protein intake, which would also lead to catabolism, and development of hepatic lipidosis. Hepatic lipidosis occurs when there's anorexia and excessive amounts of fats are broken down from the cat's peripheral storage. This fat is then transported to the liver, and the liver should then process the fat and export it to the rest of the body in a new form. In cats that develop the hepatic lipidosis, this process is impaired, and the rate of fat export from the liver is much slower than the rate of fat intake, resulting in fat accumulation within the liver cells. Damage to the liver is caused by swelling of the liver cells with excessive fat. At a minimum, impairment of liver function occurs, and in those cats with severe disease, overt liver failure results. So the advantages of early enteral nutrition include improved enterocyte health, immune function, and gastrointestinal mobility. So overall increased gastrointestinal health and all the related body systems, because obviously the whole body is connected. You can't just look at the intestinal area or just the heart or just the muscles. The body works together as one. So each is very important for all the rest of the body. It prevents catabolism and can decrease the incidence of morbidity or mortality. So we really do want to work at getting these cats to either eat on their own or helping them with tube feeding. So some things you can try to entice a cat to eat include offering a more palatable diet. One such diet we have here in the United States is called Prescription Diet AD that I use, which is highly palatable and has increased levels of protein and fat and has highly digestible carbohydrates. You can also try something like tuna fish. Another strategy is to warm the food, as that increases the smell of the food, and cats are very dependent upon the smell of their food for their appetite. This is seen a lot with cats with upper respiratory infections. Obviously, if they can't smell their food very well, they don't eat. But even just cleaning off, any nasal discharge and getting them started on an antibiotic can help them to be able to smell their food better, and therefore they will eat better. Adding something very, very palatable to the normal diet you can try, such as chicken broth or pieces of cooked chicken, or even hand feeding can be tried. If these are not sufficient to getting the cat to eat, then using an appetite stimulant, such as mirtazapine. This is the one that I particularly like and find it that works very well. And the dose given there is 1.8 milligram per cat every 1 to 3 days as needed. And then using an antiemetic can also be helpful to treat possible nausea that can be contributing to the anorexia. And here I use meropitant, which can be given at 2 milligram per kilogram once a day. Okay, and this is a handy flow sheet taken from the Journal of Feline Medicine and Surgery that helps determine when to use an appetite stimulant. So here up at the top, we have an inappetent cat. And then obviously here you're going to investigate possible disease states of why this cat is not eating and address those. If there's pain, treating that, any nausea or vomiting, using that meropitant, any fever, getting them on an antibiotic. And then you're going to look at the degree of inappetence. If it's only partial, if there's a chronic disease or a food aversion or just some short-term treatment, then at that time, look at using the appetite stimulant, and whether you get positive or negative result, then if you're not getting a result, then you go over to putting in a tube. Again, back to the degree of inappetence. If it's partial, but they are in poor body condition, if there's ever any evidence of hepatic lipidosis, so if you're seeing jaundice, yellow mucous membranes or skin or sclera, or they're critically ill, then you want to go right to the enteral feeding. If the inappetence is complete, but under 3 to 5 days, and no clinical evidence of malnutrition, again, here, then you can start looking at appetite stimulation. However, if they're in poor body condition, or you have that hepatic lipidosis, or they're critically ill, then you need to go right to the enteral feeding or placing a tube. And again, if there's complete anorexia and it's for a prolonged time, then getting that tube right into them as soon as possible. So when the decision is made that a feeding tube is needed, then you need to make a decision whether you want to place a nasoesophageal or an esophagostomy tube. So this slide looks at the two different ones here. The nasoesophageal tube is shorter term. It has a smaller size, so only liquid diets can be placed through this, and you cannot administer tablet medications through this tube. It is less stable or secure because it actually can be sneezed out or vomited out. I've actually had both of those happen. But the positive things for this tube is you don't need any sedation for placing it. And it can actually be used for feeding the cat, if they're in critical condition and you don't want to sedate them. You can eventually, when they get a little stronger, then move over to the esophagostomy tube. So with the esophagostomy tube, this can stay in long term. So when you're talking, it's going to be at least 5 days to maybe even several months for a chronic kidney disease cat where the person is having a hard time getting them hydrated or their medications and just continuing to get some calories into them. It is a larger tube size, so a slurry diet with a slurry between a canned food and water will work fine through this tube. And I will give you specific diets and what kind of water or how much water to add to those diets to be able to get through the tube. It is more stable and secure. They are not going to obviously sneeze it out because it's not going through the nose, and they really aren't going to vomit this out too because it's such a large tube that fits into the esophagus well. About the only way they would get this out is if they would be able to scratch it out from where the sutures are placed on the side of the neck. We will go over that. But the one downfall is that you do need to have general anesthesia for a short time, depending on how long it takes to place this tube. But again, if that's a problem, you can start with the nasoesophageal tube and move over to the esophagostomy tube when they are stronger. All right, so we're going to be looking at specific equipment for a nasoesophageal first, a nasoesophageal tube first. So I'm going to go to a little larger screen here to show you. So I use a cat bag for restraint, but you can also use a towel or whatever you have to help restrain, because like I say, they are not sedated. The size of tube will be a 5 French. In some larger cats, you might be able to get an 8 French, but you'll definitely be able to get a 5 French into cats. I do use some lidocaine to drip in the nose to help with just a little bit of numbing before you're going to pass the tube. For suture, I use a 3/0 nylon. And then obviously the needle holders with the scissors. I'll use some tape for waterproof tape to help secure the tube to the top of the head with like a butterfly suture, butterfly tape. And then I've got a syringe here. You can check the position of the tube with either placing sterile saline or sterile water into the tube to make sure that it's in the esophagus and not in the trachea. And then to help prevent the cat from scratching it out, then using an e-collar. A couple things that I don't have here in the picture, but you'll be able to look at on the list, would be a lubricant to help pass that tube. And then obviously, like I say, I did explain the water there in the syringe to help know that you are in the esophagus and not the trachea. All right, so the specific procedure, past this, I do have a few more detailed pictures that we'll go through too, but I'll just go ahead and go through the whole process here. So you're going to be measuring the feeding tube from the nostril, so right where it exits, down to the 9th rib, and then mark the tube at this point, at the nostril end. You're going to restrain that cat in the cat bag or towel or whatever, to have an assistant help with that. Instill just a few drops of the lidocaine into the nostril that you're going to be putting the feeding tube in, and tilt the head back slightly so that the lidocaine can flow down the nasal cavity. Either before or after you put the suture in, or the tube in, you can pass a suture into the skin just past the nary, so it'll be right in this area here, and put a square knot so that it's ready to then put this finger trap suture around it. Lubricate the end of that feeding tube and pass it down in the ventromedial nasal meatus, and should flow very, very, very well. Like I say, as long as you have the right size of tube, that 5 French works perfectly. And it's lubricated. You just go nice and slow, and that lidocaine will help it not be such an uncomfortable process for them. And you pass it to that predetermined mark that you placed on the tube, and then secure it to the skin with that finger trap suture. And then I will actually also place a couple more to make it more secure, like getting it out of the So I'll put one like maybe here with that butterfly tape and suture, and then maybe also one on top of the head. And then putting an e-collar on to prevent the cat from scratching the tube out of place. And this just shows these. Unfortunately, I did not have pictures of my own, so I did get some from the internet. So these are actually pictures that come from different cats. So here we're measuring the tube from the nares to the 9th rib and marking that tube. You've already put the lidocaine in and lubricated the tip of this tube. And the assistant is holding the cat's head, and you're just slowly, gradually putting it down in the ventromedial nasal meatus until you've hit that predetermined spot that you've marked on your tube. And like I say, either before or after, you can put that one square knot suture right past behind the nares here. You don't want to incorporate any whiskers, or that will drive the cat crazy. And then here it shows coming again out of the nares, that initial suture and the finger trap suture. And again, a lot of times I will put a butterfly suture with butterfly tape with suture here, and probably another one up on top of the head. Okay, next I'm going to go over placing an esophagostomy tube, and then when I'm done talking about both of these, then I'll go back to what to feed and how much, because it is a little different because of the size of the tube. So again, with this placement of this type of tube, we will need some general anesthesia, and there will be a surgical prep. Other equipment we have is the 14, actually let me go over to the next slide, then you can see better. We'll have a 14 French feeding tube for this one. We'll also have this curved hemostat that will show you how and why we use that. Again, the same 3/0 nylon with a needle holder and scissors, and some waterproof tape again to be allow a butterfly suture. And then not pictured here, you will need a scalpel handle, and I use a number 10 blade to make an incision. And then also an antibiotic ointment and some gauze to put directly over the incision. And then when you're all done, I use a stockinette over the neck. Other people can use a vet wrap or some kind of wrap, but you do want to be very careful that you're not restricting it too much with the jugular veins there, or with too much pressure on the trachea. All right, so again, here I'll go through the procedure, and then I do have some more specific slides that will help show the procedure. So first, we do induce general anesthesia, and then place the cat in right lateral recumbency, because there will be a surgical clip and prep of the left side of the neck from the base of the ear to the distal neck. You're going to measure the feeding tube from the wing of the atlas, so that's the side of the first cervical vertebrae, down to the 9th rib, and mark at the level of the wing of the atlas. Usually I have an assistant, or the veterinarian could learn to do this two-handed if you want, but I use an assistant to pass that curved hemostat actually into the mouth and then into the esophagus. And then I, as a surgeon, can feel the tip of that hemostat through the skin in the cervical area. And I use my number 10 blade scalpel and cut down through the skin and underlying tissue to the tip of that instrument, being careful of the jugular vein. The final layer that I'm cutting through is kind of a hard translucent membrane. I need to make the incision large enough so that the tip of that hemostat can pass through the skin, because then I will actually have the assistant pass that hemostat through the incision, and I will feed the caudal tip of the feeding tube into the jaws of that hemostat. And the assistant will then retract the hemostat, pulling the feeding tube with it to actually exit the mouth totally. At this point, you'll release the hemostat and then redirect the feeding tube caudally into the mouth, and then re-grasp that with that hemostat again to help push it directly caudally past the incision. So you'll push the tip of that feeding tube past the incision, and this can be helped by the surgeon actually pulling the extra loose tubing out of the incision. And once you feel that flip of the tube going past, then you can push the feeding tube down to the desired mark that you've marked at the level of the wing of the atlas. And again, here for securing it, you're going to place a finger trap suture at the level of the incision and butterfly tape at the level of the wing of the atlas. That's why I use the wing of the atlas as my baseline for measuring how long it is. Not all surgeons do this, but this is how I learned it, and I do find it very helpful. The suture at this level, again, it's just that butterfly tape, and the suture, I actually pass it through the ostium of the wing of the atlas to anchor it. And you can actually pull the cat's head up by this suture, knowing that it's secured firmly. And then after that is all done, you can place a gauze with treple antibiotic ointment over the incision, and then I use a stockinette over the neck to cover everything. So here is just a diagram of the procedure. Again, the assistant would be passing the curved hemostats in the mouth and into the esophagus. And as a surgeon, you can feel that and cut down over that till the incision is large enough so that that hemostat is actually passed through the skin, and you feed the caudal tip of the feeding tube into the jaws. Whoops, sorry, went too far. Into that and exit the mouth completely. And then again, this you will direct back into the mouth. They don't show the hemostats here, but I do have the assistant use hemostats to help push the caudal end of that tube down the esophagus. My pointer back here, so that it's going past the incision there. And again, the surgeon can be helping to actually manipulate this by either pulling it out just a little until that goes past, and then pushing it all the way in until that predetermined mark by the wing of the atlas. And now some pictures that depict this. Again, the measurement this time is from the wing of the atlas to that 9th rib, and marking that, and showing the curved hemostats going into the esophagus and making that incision over top. Like I say, I use a number 10 blade, but whatever blade works for you is fine. Large enough to be able to pass that hemostat through and grab the end of the tube. And here they've already shown that the tube is then going through and they've pulled it out. So then we'll again push this tube out far enough so that you can redirect it caudally, and I will re-grasp it with that hemostat and push it back down into the esophagus past where the incision is. And then this one, they've already put some type of bandage here so you can't see the incision opening, but you use that finger trap suture right by the incision. And then again, I will actually use a butterfly tape going through the ostium of the wing of the atlas to help secure the tube up farther, and then covering the whole thing with a stockinette after putting the antibiotic ointment and the gauze on there. All right, so we have our tube in. How much are we going to feed? What is the requirements here? So I go with a resting energy requirement. And how to find the resting energy requirement, you look at this formula right here. You'll take 30 times the weight in kilograms and then add 70. And that will be the total number of kilocalories per day. And that's a starting point to avoid overfeeding. An actual illness energy rate in IER is 1 to 1.4 times the resting energy requirement. So again, this is the starting point, and then we always want to monitor the weight and adjust accordingly. We don't want the cat to be continually losing weight. Then we'll need to increase how much they're getting fed. The quantity fed per 24 hours then is the resting energy requirement divided by the kilocalories per milliliter in the diet. And then you'll divide that total into 2 or 6 feedings per day, depending on the duration of anorexia and how the patient tolerates it. When first starting out, and I'll go over this again in another slide, I always start at least 4 times a day. And then if needed, they can go down to the 2 times a day if the patient is tolerating it well. And it depends too on what the owner is able to do according to their work schedule or how many people are around to help. Since the animal has been anorexic for a while, we don't want to start with their full resting energy requirement right away. So on day 1, I'll start with 50% of the total that they need. And then on day 2, I'll increase to 75% of that resting energy requirement. And then on day 3 and past that, I'm at 100% the resting energy requirement, or increasing if needed according to that body weight. The maximum volume per feeding, you don't want to go over that 10 to 20 milliliter per kilogram. So for an example, for an 8-pound or 3.6 kilogram cat, the resting energy requirement is going to be 30 times the weight in kilograms, which is the 3.6 plus 70. So your total there would be 178 kilocalories per day. All right, what to feed? Again, so the nasoesophageal tube is quite small, so it has to be a liquid diet, and no tablet pills can be given through this tube. One product we have here in the United States is called Emerade Intensive Care. It's a mix. You combine 1 part of the powder to 2 parts of water for a 5 or 8 French tube. And then the ending result is a 1.13 kilocalorie per ml blend. And this is balanced feline nutrition. So this would be more optimal because it is specifically made for cats. If you don't have a product like that and you definitely need to get a cat some kind of nutrition, I have reached for human products. One that we have here in the United States is called Ensure Plus, and it specifically has the 1.4 kilocalories per milliliter. Obviously, with human products, they can come in different flavors, and we just want to stay away from the chocolate as that can be toxic. Again, it's not balanced feline nutrition, but it can get some calories into them if needed. For the esophagostomy tube, this again is a larger tube, the 14 French, so it can be a slurry. What I use here in the United States is Prescription Diet AD. I'll mix one of these cans. It's a 5.5 ounce can with 25 milliliters of water, and that ends up with a 1 kilocalorie per meal solution. And this next slide actually shows a lot of different diets that can be used through this tube by such makers as Eukanuba, Hills, Purina, Royal Canin, and Science Diet. And it actually has for both cats and dogs. And then you look over here, this would be the water that you would need to add to 1 can for the 14 French esophagostomy tube. So the one that I particularly use is the Science Diet AD, and adding 25 milliliters to that to that 5.5 ounce can, and you end up with a 1 kilocalorie per milliliter of your final mixture. Again, these slides will be available to you, so you can come back and refer to that at a later time. This is my my discharge instructions. Again, I start with a cat's name and a current body weight, because they're going to be bringing that cat back in to reweigh, and we can monitor how the feedings are going for both the cat and the owner, and how that body weight is going. And I'll have their instructions for mixing the diet, whether it's this one is particularly for the esophagostomy tube, but you can also put the directions for the nasoesophageal tube in this area as well with the liquid diet. So again, here we're talking about the esophagostomy tube. So I'm having them mix the can of prescription diet AD with 25 milliliters of warm water. Mix the diet and the water thoroughly. The way I do it is by drawing the two up in a syringe and forcing it out again repeatedly, so that it gets well mixed. You could also, put it into a blender to blenderize it. And this allows it to pass through the tube readily. And then any remaining mixture can be stored in the refrigerator, but have them warm it up for the next feeding. I always start with a 3 milliliter warm water flush. And then administer the designated amount of warm diet over 3 to 5 minutes. And you'll want to warn them, since these are smaller tubes, depending on which one, it can be quite hard to push the solution through, just because if you have a larger amount through this smaller tube. So warn them that it will take time to not be in a hurry. Sometimes it works better to have the solution drawn up in multiple smaller syringes. That seems to pass through better than having one large syringe where you're having to put a lot of pressure to force it through the tube. If resistance is met, we have them flush the tube again and make sure that the diet is mixed adequately, that it's passing well. And then if any vomiting occurs, have them stop the feeding and reduce the next feeding by a half, because they may be getting too much at one time. And if vomiting continues, then they need to be seen to find out what's going on. And then after the feeding is done, I'll have them flush the tube with 5 milliliters of warm water, and then capping the tube so extra air does not go down into the stomach. And then I give them a schedule for the feeding. Again, on day 1, we're only going to be giving 50% of the resting energy requirement, and I won't go any less than every 6 hours, so at least 4 times a day. It can, if the people are able to, they can give smaller amounts over more frequently, and that would be ideal. Day 2 is going to be 75% of the resting energy requirement, and then day 3 and onward, it's going to be that 100% of their resting energy requirement. Again, no more or no less than every 6 hours or 4 times a day to start with. If the feedings go well over the next few days, then you can start maybe increasing the time interval and going up in the amount fed. The cats should always be fed free choice, or offer a meal before the tube feeding, so you know if the cat is regaining its appetite and able to eat on its own. Tube and skin care. We're going to have the owners clean the skin around the tube once a day with some hydrogen peroxide. Cover the incision with a triple antibiotic ointment and clean gauze once a day. And then cover that tube and gauze with a neck wrap, such as a stockinette or a loosely wrapped vat wrap or some kind of a wrap there. Just again, making sure that you don't restrict the jugular veins or too much pressure on the trachea. And then replace that as needed to keep it clean. Again, with an esophagostomy tube, medications can be given through the tube. If you crush them into a fine powder and mix it with some warm water, and then after that's given, you can flush the tube. With the nasoesophagostomy or nasoesophageal tube, excuse me, you cannot give medications through that tube. They will need to be given orally and then preferably flushed with some water since they have been anorexic. Some medications that I may dispense for these pets would be an antibiotic, since they do have an open wound in the side of the neck. You can give, like I say, the Serenia, the antiemetic, the meropitant, as needed for a few days, and the mirtazapine as an appetite stimulant to try to help to get them to start eating on their own. All right, so removing the tube. You can remove the tube when the cat is eating on its own for at least 3 to 4 days. If the cat has been critically ill, I may even extend this to a full week. If they have like hepatic lipidosis, I want to make sure that they are eating well, because it's like with an esophagostomy tube, that can stay in for a long time, and I'd rather leave it in because they can eat fine with those tubes in. It's not in the way of them swallowing, so I'd rather leave it in and be safe instead of take it out and then need to replace it again. For nasoesophageal tubes, you'll just need to remove the sutures, kink the tube so that as you gently pull it out, you aren't going to get any liquid dripping down into the trachea. For the esophagostomy tube, that you'll remove the sutures and then just gently pull the tube out. The incision is left open to heal by second intention, and they do very, very well with that. All right, that's it for the presentation today. So I will take any questions if you have, and you can please put those in the chat box. And again, just a reminder, with any of the dosages or the procedure itself, these slides will be available to you through the VetNet Foundation website. And I thank them for getting that information to you. Okay, I do have a question in the chat box. Can we give meloxicam to cats as an NSAID? Yes, we can use meloxicam. Depending on whether it's short-term or long-term, you want to be careful because it can adversely affect the kidneys. So you want to make sure that you get some baseline blood work first and monitor that if you need to keep them on that. Oh, let's see, what are the contraindications for a nasogastric tube? I guess the only contraindication here would be if there is actually a problem with the nasal cavity or the sinuses itself. If there's a mass or something where you would not be able to get that tube down through the ventral medial nasal meatus. Otherwise, it's a very safe procedure as long as you're confirming that you're getting into the esophagus and not into the trachea by, again, instilling sterile saline or sterile water to make sure that they're not coughing back up again. Okay, Indian cats are very aggressive. How to handle and restrain them? So different things that you can try here would be if you can get some gabapentin in them. A lot of times that will help calm them down. If you can, usually that comes in a capsule form. If you can break open the capsule and mix that with some canned food, that would probably be a good way to do that. Otherwise, if you need to use some sedation, butorphanol is a pretty safe sedative that you can give. What is the food used for nasoesophageal tube? Again, what I use, there's that chart in there that had a couple of different options. The one was a feline specific liquid diet. And the other is, if you don't have that, then using a human product that comes in like a shake form. What we have here for that would be Ensure Plus. Again, these slides will be available to you, so you can go back and look at that particular slide to find out what liquid feeding supplements you can use there. Do you use a local anesthetic for the sutures? I actually don't, and the cats do very well. It's just almost like, you know, if you're going to poke them for the local anesthetic, you may as well just do the suture because it's about the same, and they actually do very well. Excellent questions, everyone. Anyone else? Because these are things that every veterinarian should be able to do. Okay, a question: what is your preferred anesthetic protocol for tube placement? For the, obviously, like we said, for the nasoesophageal tube, I don't use any anesthesia, just that drop a lot lidocaine down the one nostril that you'll be placing the tube. For esophagostomy tube, I like to induce general anesthesia. So I will use you can either pre-med with like a butorphanol or hydromorphone, and then I like to have them on general anesthesia. In our clinic, what we have is isoflurane for that. Okay, how do you confirm that the tube is in the esophagus and not the trachea? Okay, very good. So again, for the esophagostomy, that's easy because you are just cutting right down. Your instrument is in the esophagus and you're cutting down into the esophagus. So with that, you know where you're at. For the nasoesophageal tube, that is a concern. So when you're putting the tube in, you're going to monitor, is the cat starting to cough? Because then the tube may be going down the trachea. Otherwise, you can use sterile saline or sterile water, either of those, to put that through the tube. Again, if they start coughing, then you need to remove the tube and try again. You can, if you have x-rays available, you can use that, as you'll be able to see the tube in there. Or you can actually also put an empty syringe, connect it to the end of the tube and pull back. If you're in the trachea, that syringe will pull back easily because there's air in the trachea. If you are in the esophagus and you pull back on that syringe, then there will be negative pressure and you won't be able to pull that syringe back. Good questions. You're very welcome.